Hello, this is Mary Pat Whaley, and today's Manager's Minute is sponsored by ManageMyPractice.com. Today we're going to talk about dismissing patients from your practice, why you would do that, and how you would do that. Sometimes patients do have to be dismissed from the practice. They could be non-compliant, largely, hugely non-compliant with what you feel like they need to do for their health care. They may be not paying bills that they've agreed to pay with no reasoning or no neediness. They may be causing disturbance or destruction in your practice, or they may have not kept to an agreement for a medication contract or have gone outside of the contract and gotten pain medication from a number of different physicians and pharmacies. Whatever the case, if you have made the decision, the manager and the physician together, to dismiss the patient from your practice, the first thing you need to do after reviewing all the information is to put together a letter, a dismissal letter to the patient, and let them know that they will receive 30 days of emergency care from your practice. And of course, what emergency care means is based on what your specialty is. Remember that you do not necessarily have to prescribe drugs during this period if the patient is on a medication that they need, high blood pressure, whatever that medication is. You may want to continue that prescription so that there's no interruption in their care. However, you are not required to see that patient for routine matters, and you are not required to write new prescriptions for medications they've not taken before. You write the letter, and you're either going to hand it to the patient in person or you're going to send it certified, return receipt requested, so that you do know that the patient has received it. Now, there's certainly a possibility that they won't sign for the letter. They may guess what's coming. They may just not pick it up. And in that case, you would have to deliver it to them in person. This is what I suggest. If they come into the practice, you go ahead and see them at the visit. And at the end of the visit, you hand them the dismissal letter and let them know why. And your administrator, your manager can handle this. The physician does not, or the provider does not necessarily need to do this. Make sure that you not only give them 30 days of emergency care so that you have not abandoned them, and make sure that you give them a list of places that they can look for replacement care. That can include the internet, that can include the yellow pages. If you have a medical society or some other local group that gives information out about physicians that are available to see patients, provide that to them in the letter. Probably one of the most concerning things to providers is if they are in a family practice or see more than one member of the family, should they dismiss the whole family? My opinion is yes, unfortunately, because you probably will have that person continue to come back into the practice, and it's just not a good thing. I suggest cut the cord, dismiss the patient and the family, and this can all be done with one letter to the family and to all the members of the family. And know that typically nothing is going to get better until the patient is dismissed from the practice. Make sure that after the patient is dismissed that it's well documented in their chart about the dismissal, whether it's electronic or paper. The letter does not have to reside there, but it can reside there. And also make sure that all of your computer systems reflect that, so the patient doesn't call for an appointment, get an appointment, and arrive at the practice before you realize you've already dismissed the patient. I hope this has been helpful to you. I know it's a very concerning topic for a lot of people. You want to do it right. And I hope you'll stop by the website, www.managemypractice.com, and see what we have there. Thanks so much for joining me today for your Manager's Minute.